Hello doctors, today we will learn about the temporomandibular joint. It is the important joint present in the head and neck chapter. So we will see about the temporomandibular joint. So first one we will see the type. Type is a complex synovial joint. It is bicondylar and a modified hinge joint that allows the gliding movements. Temporomandibular joint, it is the modified hinge joint and that allows the gliding movements. It's important. Then we will see the articular surface. Articular surface divided into two parts, superior articular surface and inferior articular surface. Superior is formed by the parts of temporal bone and inferior formed by the head of the mandible. Superior surface is divided into three parts. First one is the tubercle of root of zygomatic arch and its anterior root, and second one is anterior part of mandibular fossa, and third one is posterior non-articular part formed by tympanic plate. So joint cavity is divided into upper and lower parts by an intra-auricular disc. Middle of that joint there is the articular disc, hence joint cavity divided into two parts, upper and lower. Next one we will see about the ligaments of the joint, and fibrous capsule is common for more joints. Then we will see the fibrous capsule. Second one is lateral temporomandibular ligament, spinomandibular ligament and stylomandibular ligament. Inferior articular surface is mandible. So three ligaments related to mandible. So lateral temporomandibular, spinomandibular and stylomandibular ligament. Let's see detail in fibrous capsule. Attached above to articular tubercle, circumference of the mandibular fossa in front, and squamotympanic fissure behind and below the neck of the mandible. Capsule is loose above and intra-articular disc and tight below it. So synovial membrane lines the fibrous capsule and neck of the mandible. It is the image that you can see clearly the articulating surfaces of the joint. Mandibular fossa, articular tubercle and mandibular head, and that is the articular disc. So next we will see the second lateral temporomandibular ligament. Strengthens the lateral part of the fibrous capsule because it presents laterally. Its fibers are directed downwards and backwards. You can see clearly in image. Wait a minute. And then attached above to articular tubercle to the below to the posterior lateral aspect of neck of mandible. So it laterally present directed downwards and backwards, and its attachment. Next one we will see about the stylomandibular ligament. It is the accessory ligament of joint and represent thickened part of the deep cervical fascia which separates parotid and submandibular salivary glands, and it attached above to the lateral surface of styloid process and below to angle of the ramus of mandible. So name is stylomandibular attached to styloid process and mandible. Then the spinomandibular ligament. It is also accessory ligament, lies on deep plane away from fibrous capsule, attached superiorly to spine of sphenoid, inferiorly to lingula of mandibular foramen. It is the remnant of dorsal part of Meckel's cartilage. It is important, asked as MCQs sometimes. Meckel's cartilage. Spinomandibular ligament is remnant of Meckel's cartilage. So its relations you can remember as mnemonic mall, M for maxillary artery. Auriculotemporal nerve is A. Lateral pterygoid muscle is L and laterally L. Medially chorda tympanic nerve and wall of pharynx. So it is the diagram. You can see the ligaments, styloid process, and there is the stylomandibular accessory ligament, and it is the spinomandibular ligament, and this is the laterally present lateral temporomandibular ligament, and central is fibrous capsule is present. So ligaments are so easy. There are 4 ligaments are there, and it's over. Then we will discuss little bit detail about the articular disc. Articular disc is oval, predominantly fibrous plate, divides joint into upper and lower compartments, permits gliding movements from upper parts and from lower compartments, permits the rotatory as well as gliding movements. How? Let's see, the disc has a concavo-convex superior surface. Concavo-convex superior surface is present, and its periphery is attached to fibrous capsule, and there is disc composed of 5 parts. 5 parts, these are the anterior extension, anterior thick band, intermediate zone, posterior thick band, and posterior extension that contains bilaminar region containing venous plexus. So this is the disc, contain 5 parts. So easy: anterior extension, then band, then intermediate zone. Then next we will see about the disc prevents the friction between articular surface. It is the advantage of that disc. It acts as cushion and helps in shock absorption, like present in some cars, motors, and then it is stabilizes the condyles by fitting up space between articular surface. Proprioceptive fibers present in disc helps to regulate movements of joint, and it helps to distribution of weight across the TMJ by increasing the area of contact. Next we will see about this diagram: posterior extension, posterior band, intermediate zone, anterior band, and anterior extension is present. 5 parts of the articular disc divides cavity into 2 parts. Then its relations are there. It's not that much important, but you can remember so easily. Laterally there is superficial, that skin, fascia, parotid gland, and parotid gland contains the facial nerve branches, that also their lateral relation. And medial, by the names you can understand: internal carotid artery, middle meningeal artery, auriculotemporal nerve, chorda tympani nerve, and etc. And anterior posterior relations and superior inferior relations are there. Next we will see the blood supply. Branches from superficial, temporal, and maxillary arteries. Veins follows the arteries. It is the branches of external carotid artery that supplies blood to the articular disc and TMJ. Next we will see about the nerve supply. Nerve supply is supplied by the auriculotemporal nerve and mesenteric nerve. Auriculotemporal, auricule is a joint is nearby the auricle and temporal bone, so nerve is called as the auriculotemporal nerve. And second one is mesenteric nerve. There is the masseter muscle present at the lower angle of mandible, hence there is second nerve is the mesenteric nerve. Okay, blood supply and nerve supply is over. Then we will see about the movements. There are the 5 different types of movements: depression, opening of mouth, elevation, closing of mouth, protrusion, protraction of chin, retraction, retraction of chin, and lateral or side to side movement during chewing and grinding. Then, muscles producing the movements. Depression is by the lateral pterygoid, elevation by the masseter temporalis muscle, and medial pterygoid muscle. And these are the protrusion muscles, retraction muscles, and lateral side to side movements, chewing from left side and chewing from right side. Different are there. Lateral and medial pterygoids are opposite side of the chewing side, and this image you can see clearly and you can remember very easily. Only you should remember the origin of muscles, that temporalis, medial pterygoid, and masseter and lateral pterygoid. There are the arrows that represent their actions. So temporalis is elevation and retraction, medial pterygoid is elevation and protrusion, and masseter have 3 actions, and lateral pterygoid has 2 actions. This image you can see and you can remember and you can write. You should not remember the theory. This diagram is so important and very easy to understand. Then next and last one, we will see the clinical cases. First one is dislocation. Dislocation is commonly anteriorly and during excessive opening of mouth. Head slips forward underneath the articular eminence in infratemporal fossa. Patient can't open mouth in the case of dislocation of TMJ. Then palpation of TMJ, you can do the palpation 1.5 centimeter anterior to external auditory meters. TMJ syndrome, it is disorder due to disorders of TMJ, jaw pain, headache, and then the clicking and popping sounds at TMJ may occur due to arthritis. And here you have seen all the important points about the TMJ. It is the most important and in university high yielding. And if you like it, share, like, and subscribe, and comment for any another topic for explanation. And thank you.